Hello, my name is Elizabeth Denver and I run a nurse-led hypertension clinic at the Whittington Hospital in North London in England. I'm going to talk to you today about setting up a nurse-led clinic. First of all, you need to identify what is the service need, and then what is going to be the referral criteria to the nurse-led clinic. It's important that you sit down with other members of your multidisciplinary team to decide what the criteria should be. Who is going to refer to the clinic? Is it going to be an internal referral or is it going to be external? In other words, is it just going to be people within the multidisciplinary team who refer patients to the nurse-led clinic, or will it come from people in primary care or general practice or community doctors? The other things you need to look at in your referral criteria is what kind of patients. Is there going to be a specific cut-off point? For example, if you were running a diabetes specialist nurse clinic, you may look at the diabetic control level of hemoglobin A1C as your referral criteria. If you're looking at blood pressure clinic, it may be patients who have difficult to control blood pressure or patients who are newly diagnosed. Whatever the reason, it needs to be agreed. You also need to look at the clinic visits. How often is the nurse-led clinic, how often are patients going to attend the nurse-led clinic? Are they going to come every month? Is it going to be just a one-off visit? Some nurse-led clinics, they only see the patients maybe once. In other clinics, they may see them every month for 6 months. But this is a decision that needs to be made together with your colleagues. How long is each clinic visit going to last? Is it going to be 10 minutes or 30 minutes? What's going to take place at those visits? And who is going to supervise the nurse running the nurse-led clinic? Because there will be patients that they may find they can't deal with. Who are they going to go back and talk to? The next thing you need to look at is who is actually going to run the clinic. What competencies will that nurse require? Will further training be needed? Does the nurse need to be an independent prescriber? In England, we have independent prescribers who are not doctors. They're called non-medical prescribers. If they are not going to be a prescriber, if prescribing is not allowed in your country, then who is going to prescribe medication changes? Another thing you need to think about is whereabouts is the clinic going to take place? Is it going to be in secondary care in the hospital, or is it going to be in primary care in the community practice? How many clinics is the nurse going to run per week? Maybe they will start with 1 per week, and as the patients build up, increase the number of clinics. And also, as I've said before, how long is each appointment going to last, as this will affect how many patients the nurse can see each week in each clinic. There are also implications for the hospital or the community practice where the nurse-led clinic is taking place. It could be that the nurse will require some equipment to be purchased. There's also the patient's medical notes. If it's in a hospital, this may involve the health records department pulling more notes for the clinic. There is also the appointments. Who's going to book the appointments for the nurse-led clinic? Is it going to be through the central appointments service, or will the nurse do it themselves? And who is going to write the letters? If this is taking place in secondary care in a hospital, then the nurse may well need to write a letter after each clinic visit to the general practitioner or the community doctor to explain any treatment changes that have taken place. Who is going to write these letters? Is it going to be the secretary who normally writes the letters for the consultants, or is the nurse going to write it herself or himself? Also, if the nurse is going to be an independent prescriber, there will be implications for the pharmacy department in the hospital. They will need, or the primary care, they will need to know whether or not the nurse is a prescriber and that prescriptions will be expected from this particular individual. Finally, you may want to look into auditing the effectiveness of a nurse-led clinic that you set up. There are several ways of doing this, and you can find advice, I'm sure, about how to audit, but it's a good way of looking at whether or not the nurse-led clinic is being effective. I hope you found this useful. I will be providing some references for you at the end of this video, and I wish you all the best with your nurse-led clinic.